In this study, we investigated the optimal wash time to avoid drug-drug interaction between metronidazole and busulfan during hematopoietic stem cell transplant conditioning. Busulfan is a bifunctional alkylating agent and is a mainstay of conditioning regimens prior to hematopoietic stem cell transplant. Busulfan has a narrow therapeutic index and a huge inter and intra-patient pharmacokinetic variability, attributed to factors such as age, liver function, and interacting concurrent meds. Busulfan undergoes extensive hepatic metabolism via cytochrome P450 dependent pathways and glutathione conjugation. Metronidazole has a major drug-drug interaction with busulfan. Metronidazole significantly decreases busulfan clearance, thereby increasing serum concentration and overall exposure of busulfan. This increases risk of busulfan-induced treatment-related toxicities. Hence, metronidazole should not be administered concomitantly with busulfan. However, if metronidazole needs to be administered, because of this major drug-drug interaction, it's important to establish an optimal washout period for metronidazole prior to administering busulfan. Methods. Patients were selected between March 2016 to July 2019 who received metronidazole within 168 hours or 7 days prior to first dose of busulfan. 9 patients were identified. Data regarding patient demographics, toxicities, incidence of sinusoidal obstruction syndrome, length of stay, date, death, and cause of death were captured using REDCap. Busulfan pharmacokinetic data was collected from Busulfan pharmacokinetic database at MD Anderson. Since metronidazole decreases busulfan clearance, it's expected that any busulfan dose administered very close to the last dose of metronidazole would have a significant suppression in busulfan clearance, and any follow-up PK which would be done later on would have a recovery of clearance or increase in clearance. At MD Anderson, for every patient which undergoes transplant using busulfan, typically gets 2 PKs, one test dose. The first one is a test dose in which we determine the patient's clearance, and the second is a follow-up when the patients receive the actual dose for conditioning regimens to confirm the PKs. So for all the patients which we had, in 9 patients, we had a test dose PK and a therapeutic dose PK or second PK. Typically we observe between a test and the second PK of 10 to 15% increase in clearance. Hence, any clearance greater than 15% between the first PK or the test PK and the second PK was considered as a significant impact of metronidazole on busulfan clearance, which will be explained again in figure 2. Results. Patient demographics. As we can see, the majority of the patients were males. For cancer type, majority of the patients had acute myeloid leukemia. Transplant type, majority of them were match unrelated donor. Stem cell source, it was almost equally distributed with bone marrow and peripheral blood, and majority of them underwent myeloablative regimens. As far as toxicities are concerned, all patients developed grade 3 mucositis. No one developed SOS. All patients developed hepatotoxicity ranging from grade 1 to grade 3 and 4. There were 3 patients who developed grade 3 toxicities. The effect on length of stay in these patients was normal. The median length of stay was 50 days, with the range from 23 to 143 days, and the average was 57 days. Now, looking at the effect of metronidazole on busulfan clearance, the x-axis is the % change in busulfan clearance, which is the change in busulfan clearance, or you can say recovery, between the first dose or test dose PK and the second PK, or the PK collected during the therapeutic dose of busulfan. On the x-axis is the time from last dose of metronidazole and first dose of busulfan. As you can see, that the further or closer you are to the last dose of metronidazole, there's a significant increase in busulfan clearance. For a patient who received busulfan 8 hours post the last metronidazole, there was a 25% increase. For a patient who received first dose of busulfan within 52 hours of the last dose of metronidazole, there was a 17% increase. Beyond that, all the patients had a lower increase in clearance, less than 15%. This red line indicates 15%, so anything above 15 is what is significant. So we can see that the effect of metronidazole stays beyond its 5 half-lives. So this 40-hour is the metronidazole half-lives, and we see obviously effect in the first 40 hours and also at 52 hours, which is beyond the half-lives. In addition, we also did a follow-up PK for the patient who received the metronidazole dose at 8 hours and 56 hours, and there was a significant recovery in busulfan clearance, and it was 3.9% compared to the first PK, compared to the last 8 hours PK. So overall, we can see that after 72 hours, there is no effect of metronidazole on busulfan clearance, and typically we give IV infusion every 24 hours. So the optimal time for washout period would be 72 hours before we can start busulfan. So in summary, patients receive their first dose of busulfan ranging from 8 to 161 hours from last dose of metronidazole. Patients received 16,000 to 20,000 micromolar per minute busulfan course AUC exposure. Of course, the data which I explained here is in busulfan clearance because that's what we are measuring, but it ultimately affects the exposure. Significant increase or recovery of busulfan clearance was observed at 8 hours, a 24% increase, and 52 hours post-dose of metronidazole. Follow-up busulfan PK check of the 8-hour patient at 56 hours post-metronidazole dose showed a 3.9% increase compared to 24% observed after 8 hours. There was a significant suppression in busulfan clearance up to 52 hours post-metronidazole, while it was not substantial after 72 hours. There was no difference in treatment-related toxicities in all patients experienced grade 3 mucositis, grade 1 hepatotoxicity, and no one developed SOS. The median length of stay was 50 days. 4 patients have expired in this study, and they expired due to either post-transplant relapse, respiratory failure, or infection. So in conclusions, there were no major toxicities in these patients who received metronidazole prior to busulfan. Significant suppression of busulfan clearance by metronidazole was observed at 52 hours, suggesting a 72-hour washout period for metronidazole. If busulfan needs to be administered before 72 hours, we recommend additional pharmacokinetic monitoring to adjust dose based on incremental recovery of busulfan clearance. Thank you for listening to the presentation, and thank you for your time.